Managed Care and Integrated Systems by Professor Tammy.
Managed Care and Integrated Systems, Part 3. Integrated systems form in response to the growing power of managed care. Organizations have pressure to reduce costs, which was hard for small providers. Just think of it as smaller organizations. Integration and networks became a rational choice for survival. So you had to kind of work with each other. Mergers and acquisitions have picked up since the ACA was passed. Integrated delivery systems. Integration of several organizations under the same ownership or contractual arrangements. They provide an array of healthcare services to a large community. A full integrated health network typically includes one or more acute care hospitals, ambulatory care facilities, one or more physician group practices, one or more long-term care facilities, home health services, ownership or contract with one or more MCOs, managed care organizations. Positive effects on quality of care is also important, low health service utilization, and cost savings. Accountable care organizations, integrated groups of providers, delivery coordinated care, take responsibility for quality and efficiency, serve Medicare fee-for-service population, and share savings program under the ACA. Types of integration. Integration is based on major participants. Integration based on ownership or affiliation, like who you're connected to and who owns it. Acquisition and mergers, joint ventures, alliances, and virtual organizations. Integration is based on service consolidation. It's like a horizontal integration and a vertical integration. Integration is based on major participants. PHO, Physician Hospital Organization, is an alliance between physicians and hospital. It's like a friendship, an agreement, a work together between doctors and hospitals. Together, they have greater bargaining power with MCOs, managed care organizations. Large PHOs, physician hospital organization, can contract directly with employers, generally initiated by a hospital. Physician autonomy is preserved. So when you think about it, the physician still kind of works for themselves, but they're related. They work with the hospital. Acquisition and mergers. Acquisition is purchase on one organization by another. Merger is when two organizations join to form like a single entity, like T-Mobile and Sprint. They are now one company. Results achieved is gain efficiency, open new satellites like little health centers around, and regional health systems. Integration based on type of ownership or affiliation. The joint venture, a jointly created independent organization based on cooperation instead of competition. So they're working together instead of competing with each other. Helps the joint owners diversify into new services. Alliances, based on agreements between two organizations, does not involve joint ownership or assets. Mainly involves resource sharing, so they kind of help each other. Gives an opportunity to evaluate advantages before a merger. Requires little financial commitment, can be easily dissolved. So if you don't like each other, you're like, okay, we're on our own now. Virtual organizations. Formation of new organizations based on contracts. Prime example is the IPA, Independent Practice Association. And the main advantage is low capital outlays. Horizontal integration is a growth strategy in which a healthcare delivery organization extends its core product or service. The main objective is to achieve geographic expansion. Vertical integration. It links services that are at different stages in the production process of healthcare. The purpose is to increase the comprehensiveness and continuity of care. It's a diversification strategy, like have different ways, strategies. Can be achieved through acquisition, mergers, joint ventures, or alliances. Conclusion. Most Americans receive care through managed care. Cost savings have been achieved while quality is maintained. Integrated delivery systems emerge as hospitals and physicians face pressures from managed care to cut costs. Integration allowed large health organizations to win sizable managed care contracts. Delivery of care has become complex. Under the ACA, the government is experiencing with ACOs, accountable care organizations, in hopes of reducing costs and improving quality.
See you soon. And remember to read the book.